Hey everybody, Chaz Molder, Mayor of the City of Columbia, coming to you today with our next installment of our virtual town halls. As you know, we've been having these virtual town halls over the last several weeks as a way for all of you in the City of Columbia and beyond to see what's going on in Columbia, to show the continuity of government, that provide transparency, and also to be an information source. And today, I'm particularly excited about that information source that we're going to be bringing to you as we have the Director of Public Health for the Maury County Health Department, Kinney. And I was thinking a few minutes ago about today's virtual town hall. And, one of the best parts about being a small town mayor of your hometown is that you get to have really close personal interaction with a lot of folks in town. And as it turns out, a lot of those folks are people that I know and have known for a very long time, and today is no exception. Kinney is someone that is a personal friend of mine, dating back all the way to high school when we played high school football together. Andy was much better than me, as you might imagine. And also his brother, who was a football player as well, and we all knew each other, and then we were all at UT together in same fraternities. And come back home. And I'm particularly excited today because, again, we get to talk to not only a professional in the field at the Maury County Health Department, but also a personal friend. And Andy is a prime example of someone who wanted to come back home to serve his community, and serving his community is exactly what he's doing. So, Andy, thanks so much for taking the time to join us today.
Absolutely. Thanks for having me.
So we just got the recent numbers as of about 10 minutes ago for Thursday, May 21st for COVID-19 cases. And we have 74 confirmed cases in Maury County. 43 of those have recovered. We have 31 active cases and 0 deaths. And of course, knock on wood, we've continued to escape any confirmed cases in the nursing home, which is a very important thing to highlight. And so, Andy, with those numbers, you've been following these since the very first confirmed case in the state of Tennessee, which seems like eons ago, and up to the point today. How do you think we're doing in Maury County, and just how are you feeling about our prospects?
I think we're doing fairly well. I mean, of course, your goal is to have 0, and that's not happening yet. So you definitely don't want to give a failing grade or any type of grade really until we have a better idea of where we're at. It's been a few weeks since the governor has started releasing phases of reopening back to quote normal way of life. But if you look at the number of tests we're doing daily, and not just necessarily in our county. So when you see those county test numbers on there, that's Maury County residents that have been tested, regardless of where they have been tested. We have a large population in northern Maury County, as of course everybody knows, and they might choose to get tested at a Vanderbilt clinic that is in Spring Hill, or they may choose to go to the Williamson County Health Department, which is testing at the Williams County Ag Center. So depending on where you are on I-65, you might choose to go there versus coming down here to 1909 Hampshire Pike. So the amount of tests that have been conducted over the last 2 weeks versus the first 6 weeks that we started testing is a huge jump. So percentage-wise, we're doing fairly well with the amount of positives that are coming out of those tests.
Yeah, I mean, you look at the amount of negative labs that we've had in Maury County compared to our confirmed cases, we seem to be under the state average for positive cases. And if you look at where we stand ranking in confirmed cases, we're actually outperforming from the perspective of our population. And so we seem to be doing well, but you make a good point. I mean, the more tests that you have, the more likely that you're going to have continued confirmed cases. And that's likely to continue over the foreseeable future. Wouldn't you agree?
Agreed. And again, just to build on that, we have been 2 weeks now phasing into reopening certain things, whether it's 25%, 50, 75, or 100. People are returning to work where they possibly could have been working from home, or alternate locations where social distancing was possible. Maybe it wasn't at their normal work environment. And we've been doing that for 2 weeks now, and we have increased testing over the last 2 weeks. So that's another thing to consider. And tests are still kind of down with the number of tests, and we're back to normal somewhat versus the first 4 to 6 weeks of testing where everyone was locked down or, isolated in quarantine.
Well, yeah, and speaking of that, of course, the Maury County Health Department has been such a good partner here locally, here in the city of Columbia particularly. We've had some off-site testing now at Woodland Park a few weeks ago, and then more recently at Columbia State. where your department was coordinating with the National Guard and local police departments to have a really smooth process for testing for anyone who wanted them for free. Talk, if you will. I know that we've sort of come a long way from where we first started in terms of the availability of testing and also who would qualify for test. But if someone is sitting at home watching this and they think that they want to test, describe that process, and are they able to do it, and how much does it cost?
Absolutely. Well, testing here at the Maury County Health Department is free. I don't know about private offices. There are different kinds of tests. There's one offered at a clinic in Spring Hill that is fairly instant. It can give you a result in less than 30 minutes. That's going to cost money. I don't know if insurance pays that. I believe it does. And the one here is free. To qualify, just show up. You can call ahead of time and let us know you're coming. Regardless, we'll be outside. If it's a nice day, we're set up out front with our tent. You just pull up. We'll collect information from you and then conduct the nasal swab. If the weather is poor like it has been the last few days, we would be set up in the back. We do have plenty of arrow signs to direct traffic if you do not choose to call us ahead of time. That will lead you to where the testing site is. We choose the back because there's a loading dock area that can protect our PPE and supplies from the rain and wind. It's not the most comfortable test, but if you've ever had a flu swab, it's very similar. So it may be uncomfortable for just a second, but everybody that I've seen get tested has survived.
Well, that's good to know. In fact, I was going to ask you about the invasiveness of the test, and so you've already answered one of the questions. It's basically akin to a flu swab, which again, it's one of those very short-term pain for long-term gain because you'll know whether or not you have the virus or not. So I know, Andy, initially an individual had to have certain symptoms in order to qualify for the test, or they had to have a confirmed contact with a confirmed COVID patient. Those requirements at this stage in the state of Tennessee are no more, correct? So anybody that wants one for whatever reason could come and get a test.
Absolutely. So in the very beginning, we were trying to keep up with those people that had close contact and people with symptoms, regardless of close contact. They were encouraging everyone to go to their primary care provider, or whether it's a pediatrician, a family medical nurse practitioner, doctor, physician assistant, whatnot. They encourage you to go to your primary person of care because they have a better history of you. And then, of course, at the health department, we have primary care for individuals that are uninsured. So those are the people that we were testing on a day-to-day basis in the very early stages. As you know, I mean, that has lightened up, and they just have been wanting to test as many people as possible. And that's one of the reasons for the off-sites, is where a lot of health departments were maybe not the most available in terms of location in the county or cities. Going off-site gives some people who may have trouble getting transportation access to those sites, even though they weren't symptomatic. And we might continue to do those in the future. Right now, we're just trying to do day-to-day. We're averaging about 50 tests here or at the Maury County Health Department. I don't have the numbers of Maury Regional Medical Center or the other providers across the county. But we also need to make clear that in those tests that we do daily, we're seeing a lot of people from out of county. So our surrounding smaller counties that may work here, may have a symptom or two, or maybe they felt that they were in contact and they decided to stop by here and get a test, before going home. Of course, our smaller counties where we might have a lot of people commuting to work here, Giles, Lawrence, Lewis, whatnot. Those are the three more that we see come through here.
So what about the return of the test? I mean, if I come in tomorrow morning at 10 a.m., when could I expect to have the results back?
24 to 72 hours, depending on, what's going on. We may have a huge influx of tests across the state and across the mid-state, to where the lab may have a lot more one day, than another. So just 24 to 72 hours. We have a good rate of getting the test in the next day, but it's not guaranteed.
Another question, and I actually had this question posed to me last week, and I tried to answer it, but I'd be interested to know what your answer is. If someone is sitting at home watching this today and not having any symptoms of a fever or anything of that nature, and not having any known contact with any COVID confirmed case, would you recommend that they come and get a test if they feel like they want to test just to know? Or is that something that, unless there's some circumstance, you would say there's really no reason to have the test at this point?
Well, if they are thinking about getting it, there's obviously, I mean, that process has already started in their mind to where they have a concern of some kind, whether it's interaction with a person in their family or close circle of friends that's immunocompromised or maybe in that high risk population. We would definitely encourage that. I mean, once again, you're thinking about it, so there's already somewhere in the back of your mind where you're concerned that maybe you need to get this test. And by all means, please come here and we'll get you tested and we'll get you set up. But we do encourage everyone to quarantine for that duration and isolate. Do not, I mean, after you leave here to get your test, don't go to the grocery store, don't go see that person that may be, immunocompromised or high risk population. Maintain in your home and, social distance and isolate until you get your test results back.
Well, that's a really good answer and much better than the answer I provided, I'm sure. And so to your point, though, about testing, the preference is that individuals that want to test, they're able to get a test, but to call the health department, which is 388-5757, prior to coming out there so that y'all can be aware that they're on their way and that you can be set up and ready to take them in.
Yeah, and they don't have to. They can just show up. But we always encourage, if you're calling, you might have a question that you want to ask on your way to us, and we can help you get prepared for your visit to get tested.
And just briefly, I know that the antibody testing is something that is a hot topic, at least in the media and seemingly in social conversations. I know that that's not become available yet necessarily, at least at the local health departments. Perhaps it's available in some of the private providers, but what's your outlook on that? I mean, is that something you think the health department will ultimately have testing-wise, or is it just too soon to know?
It's way too soon to know. I haven't been given enough information. I haven't really been able to find a lot of actual good research on it as well. And we reach out to our, definitely our network in the Department of Health, and all Department of Health and states communicate with each other, much like you local leaders in the communities. You talk to other county and city mayors. So the Department of Health is no different. These physicians and doctors, epidemiologists, they communicate across the country. So I just haven't been provided enough to give an answer on that without having someone next to me that is a professional and expert in that matter.
Right. Well, sitting here talking with Andy Kinney, the Director of Public Health for the Maury County Health Department. Andy, you mentioned the coordination that's been going on throughout this process. And to your point, you mentioned Maury Regional, obviously the Maury County Health Department, Mayor Ogles and myself and Rick Graham and Bill White. And really there's been a lot of communication and collaboration, which I think has been very fruitful and positive as we've sort of managed through this crisis together, recognizing that, none of us really could have predicted this 6 months ago. And then all of a sudden it just hit us and there was really no time to breathe, frankly. You just had to continue on. And so we really do, on behalf of the City of Columbia, appreciate the partnership that we have with Maury County Health Department and Maury Regional, really all of our medical providers, private providers included. Maury County is very fortunate to have very good medical community as a whole. Andy, just to sort of round third and head home, let's talk real quick about obviously the governor has begun the process of reopening. And in fact, we're pretty far along in that process for at least 89 of the 95 counties. The 6 large metro regions have some additional autonomy to make some decisions, but even those 6 counties are starting to open up more and more as we see as the days go on. But there's been the Tennessee pledge that the governor's released, and we're getting to a point now where a lot of the closures are no more. But there are still some of those CDC guidelines that the governor and the president and our medical community here at home and across the state and country are requesting that we adhere to. So talk about those CDC guidelines. Even though we are back open as an economy, it is important that we continue to adhere to a lot of those guidelines, correct?
Correct. I mean, they're putting them out there for a reason, and that is for public safety. So it's definitely something we encourage. Masks, we encourage. If you are in that high-risk population or immunocompromised, reach out to friends and family to maybe do some of those errands for you, or help provide whatever service they can to you so you don't have to get out and continue social distancing. We definitely encourage those social distancings. Be self-aware of your health. people are taking temperatures of employees, people are taking temperatures of visitors into their businesses, and they're doing that for a reason, not just because they're guidelines, but because it makes a difference. So we just continue to ask people to adhere to these guidelines. I mean, they're not mandatory, they're guidelines, but it's for public safety. If you have any trouble finding a question that you have on CDC or tn.gov, please reach out to your local health department. We can help the best we can find you that answer. Businesses have been reaching out to us. Community members have been reaching out to us. We may not have the answer right when you call or email us, but we definitely will send it to the right people to get that answer. So, I mean, it is very important. I mean, they're not just up there to talk because it's the, cool thing to do. They're doing it to help, rid us of this virus.
Yeah, well, I tell you, we've been, again, to sort of sing your praises. A lot of the questions that come through us, we funnel to y'all because we recognize that y'all are the medical professionals, and of course, y'all are getting your guidance from the State Department of Health, for which you're an entity of, and of course, they're also getting a lot of their guidance from CDC. So it's sort of it flows up and down, and to your point, the guidelines are guidelines. They're not mandatory, but also there is some self-responsibility involved, and whether or not you feel comfortable in wearing a mask or not. I think as we talked before we came on air, if someone wants to wear a mask, don't make them feel uncomfortable for wanting to wear a mask, recognizing that there are different opinions, and so we're all in this together. And certainly, if nothing else, the social distance guidelines, and also just exercising better hygiene, and which may be one of the good results of this is that a lot of us are finding ourselves washing our hands more, or maybe being a little bit cleaner. And I know I've gotten on my wife's nerves as much as I like to spray Lysol throughout her house, but it's just something that I like to do. But it might not be something everybody likes to do. But it's really, we're all in this together kind of approach, and the medical community is sort of the driver in that regard.
Absolutely. Like I said, being self-aware of yourself, but also be aware of others. You may be out at a retail store, a restaurant, a grocery store, just name your place, tire change, oil change. And just because you're choosing not to wear a mask, don't forget the person next to you may not have a family member or friend available that can do these things for them, and they are in that high-risk population. So it's just, once again, looking out for your fellow community members, and just trying to be as safe as possible. Washing your hands, of course. Even if this never happened, and we've been preaching it for years, especially during flu season, cold season, wash your hands, be aware of what you're doing, what you're touching. But we just continue to, encourage all of these ways to help, confine and decrease the spread.
Speaking of masks, does the Maury County Health Department have masks available if someone wants one?
I was going to bring it up if you didn't. We have tons of masks. We get more shipments in each week. We've been delivering them to multiple businesses and government buildings. The DMV, of course, is an example. I've taken some to the main fire hall right there on 31. We've dropped some off at Housing Authority. We have given them to churches. Anybody who wants them, please call us. We can arrange to help drop them off if available, or we can just have some sitting outside ready for you with your name on it to come pick them up. They are here for the community. We are not trying to hide them from anybody. It's just taking us some time to get them out to multiple areas. But they are here. They're free, and take as many of them as you want or need.
Well, so you've heard it from the Director of Public Health for the Maury County Health Department. Testing at the Maury County Health Department is available. It is free to anyone and everyone who wants it, symptom or not. And if you are in need of a mask and would like to have one, or maybe more than one, maybe you want to get one for your family, maybe you want to get one for your coworkers, masks are also available at Maury County Health Department. And Andy, if someone wants to learn more, I've already given the phone number, 388-5757. They can call the main line to Maury County Health Department. They can visit the health department. If you'll give that address again.
1909 Hampshire Pike. If you continue past Columbia State Community College, you will pass the DMV, and then you will go over the bypass, and we are the first building on your left.
First building on the left on Hampshire Pike. After you go over the bypass, you can visit them. You can also go online, tn.gov/health, for more information. And I was visiting that site before we came on, Andy, and I think you were as well. There's so much information on the Department of Health's website for the state, whether it be the updated case information, which of course they update every day at 2 p.m., to the CDC guidelines and links that the CDC is offering. So there's just a plethora of information. But you would encourage everyone to call or email or to come down and see you, right?
Absolutely. Calling is preferable because we are trying to limit as many people in the building as we can. We do have some services that we've continued to do here, throughout the whole time of the pandemic. And we also continue to offer those services for uninsured adult that might have chronic diseases, hypertension, diabetes. WIC services are also available. We're conducting them on or over the phone. You can also, if you didn't know, it's an EBT card style voucher now versus paper, so we can do those electronically. We're just trying to limit people that are coming in the building for the public safety as well as our staff. So if you're interested in any of these services, please get on Maury County government's website, and you can look at our health department page for information on services offered during the pandemic, and we'll try to help you there. If you're on the website, tn.gov/health, and you have an area that or a question you're trying to get answered and you can't find it, please feel free to call us or email me. My email address is on the Maury County government website, and if I don't know it, we'll try to find someone who does, and we'll help you get the answers you need.
Well, Andy, thanks so much for joining us. I have a long history with the Maury County Health Department, primarily because my mother was a longtime nurse at the health department and was the nursing supervisor before going to the regional office. And of course, my memories of the Maury County Health Department go back to Blythewood Drive days when it was right behind the Trotwood McDonald's. And as much as things have changed in terms of location, from my perspective, the Maury County Health Department continues to do the good work providing public health services to those in our community who need it most. And so on behalf of all of us at the City of Columbia, we thank you not just for your leadership and good work during this pandemic, but really, frankly, for your leadership and the work of the health department that it does, regardless of a pandemic or not, because there's always good things happening and good medical treatment going on at your department. So, Andy, thanks so much for joining us today with this virtual town hall. Again, 388-57 is the number. You can visit their website, tennessee.gov/health, or the local Maury County website will direct you there. They're on Hampshire Pike, 1909 Hampshire Pike. Go see them, get a test, get a mask. Continue to stay safe. And on behalf of all of us at the City of Columbia, thanks for tuning in, and we'll see you next time.
Thank you, Chaz.